Hi everyone, I'm Jed Shlackman. I work as a holistic mental health counselor. That includes doing work with energy healing and hypnotherapy. For this video, I'll be speaking about the topic of mental health and dental health or oral health and how those can be connected or impact one another. Our mental health is certainly affected by our nervous system, by our brain, by the chemicals and hormones and all kinds of things that are going on in our body. So anything that affects our physical health naturally can affect our mental health. You can think of the nervous system and the brain as kind of an interface between our mind and consciousness and our physical body. Now the mouth, the oral area, that's where we take food into our body. So we're taking things in there and then it's brought through our body to be converted into things that nourish us, and whatever leftover debris gets created needs to be cleared out, expelled, and that metabolic process is continuing in an ongoing manner. And when it gets disrupted or disturbed in some way, that can affect many aspects of our body, including the nervous system. Many of you could think of examples of a person who seems to function in one particular way. They have a certain demeanor or personality, and then when they consume a certain drug or medication, their personality seems to shift or change. So something chemically, physically affecting their nervous system is having an impact upon their mind or mental state. So we can look into dental health and oral health and how that area of the body can affect the nervous system and thereby have an impact on our mental state and mental functioning. In our mouth, we're consuming food, and when you consume food, there's some debris that gets left over. That debris can feed bacteria, different microbes. Naturally, the microbes are there to break down dead or decaying matter. So whatever food you've consumed, that is essentially decaying matter. The part that goes through your digestive system, that's being processed there, so you can break it down into its components and extract the nutrition from it. That process actually begins in your mouth as your saliva and the enzymes there start to break down the food that you're chewing, and then it goes further into the system for further processing essentially. But there are bits of it that get stuck in the mouth, and there are microbes continuing to break down that material, and those microbes produce waste products, things that over time can start to break down your teeth, and there's the potential for that process to lead to infections going deeper into your body. So your teeth can break down and have cavities, so that's kind of like an infection in the bone material of the tooth, but then it can go all the way down around the gums, down into the root, down into your jawbone, and ultimately into your bloodstream, where it could affect your whole body. Our teeth are also connected to our energy meridian system, the meridians that acupuncturists are working with. So there are those energy circuits going through your body, and if you have a problem with a tooth, that can disrupt the energy flow in that particular meridian. So the oral health in that context can affect the health of the whole body. It can affect the nervous system and how your mind is functioning in that sense. There's also been an issue with the fillings that are used in dentistry. Many people have received mercury amalgam fillings, and those types of metal fillings can release the metal ions into the body, so you can get essentially a form of poisoning from the metal as it starts to leak into your tissues as it comes off of the filling. And metals can really impact our nervous system. Mercury is one that's known to be quite toxic, and it's associated with a range of mental health and neurological diagnoses. So if you have some form of neurological disorder or various forms of so-called mental illness, in some cases that could be related to the buildup of metal toxins in your brain or your nervous system. So in dentistry, since they've used some of those potentially toxic compounds, if you have those, you might want to consult with a dentist who works on ways to detox from that or compensate for it in some manner to buffer those toxins. In some cases, people have fillings taken out and replaced with a material that's less toxic or less hazardous. So if you're being exposed to toxins from dentistry, consider that could impact your mental health. And if you go on a protocol to reduce your exposure or clear out those particular toxic elements, you might find that your mental state improves, that you're able to focus better, that your mood stabilizes. You might find that you're sleeping better, that you have less inflammation in your body. So there are many particular associations there between physical and mental symptoms and things that have been part of a dental health protocol. Another common concern related to mental health pertaining to oral health and dentistry is the use of fluoride. Fluoride is a compound that has the element fluorine in it, so it's fluorine paired with some other element, and it's been used in dentistry as a way to kill bacteria. So dentists have long believed that that helps prevent cavities. So it's been used in toothpastes and rinses, and it's also been added to public drinking water supplies in many places. However, there's a lot of research that's been collected and accumulated from all over the world over many decades, showing significant risks to physical and mental health related to excess exposure to fluoride. So if you're concerned about your mental health, your cognitive functioning, then you would want to consider alternatives to fluoride, safer ways to address infections or bacteria in your oral area. So you can use herbal remedies to help fight bacteria. There are essential oils that can help with that. There's also the use of ozone. Ozone's becoming more commonly applied in dentistry now, and people can even create their own ozone water, where you just take regular purified water and infuse it with some ozone gas, and then you can rinse and gargle with that water to clear out any infection or bacteria that's accumulated in your mouth. So when you do that, you're also helping protect your whole body. You're ensuring that infections in the oral area don't go deeper into your system. If you think about respiratory infections, we think of getting exposed to them through the nose and mouth as we're breathing. So if you can quickly kind of disinfect or sterilize that area, you're also reducing the likelihood of respiratory infections developing. So our oral health, our dental health, and our whole body health and our mental health are not separate from one another. We can consider the connections. I hope that this short discussion has given you some things to think about or consider. If you have other issues in the area of holistic health that you'd like to explore, I invite you to look into other videos I've done. There are also additional holistic health resources on my website, phinsights.com. That's phinsights.com. For now, I wish everyone a wonderful day. Namaste.